Ladies and gentlemen, thank you for joining us this afternoon. My name is Adam Paoli, and I am the founder and lead wealth planner for Coltiva Wealth Planning Partners. Allow me to welcome you to our next episode in a series of webinars that we're calling What You Need to Know, that we host alongside pertinent subject matter experts to provide you with what's useful information about what's important now, especially when it comes to topics that impact your retirement. Many of you know the team at Coltiva Wealth, and you know we remain passionate about educating and helping people. Most of our waking hours are spent face-to-face or now screen-to-screen with our clients, helping them establishing goals that impact their finances and their families, designing strategies to achieve those goals, and then executing them. Along the way, we are blessed to build deep relationships with our clients, and we're passionate about helping them beyond just the management of their investments, discussing topics like where to retire, which is increasingly not here, how to pass their wealth on to their kids and teach their kids about money, and how to remove anxiety behind critical life decisions, and many other conversations as a part of our process, which we call the path to prosperity. One important but often misunderstood aspect of every American's retirement plan is health insurance, leading up into and into retirement, and the different aspects of Medicare. Today, we're going to take a deep dive into the different components of Medicare and answer some of the most frequent questions that we receive as we chat with our clients. Little housekeeping issues before I introduce our speaker. Our webinar is scheduled today for 45 minutes, and we're going to do our best to stick to that so you can get on with the rest of your evening. If you have any questions along the way, feel free to type them into the Q&A section, and we'll try to address them on this call. And if we can't get to them, we'll make sure we follow up with you directly. All of our participants are going to be muted on this call. So if you have any technical issues, please message me directly in the Zoom invitation or shoot me an email as well at adam@coltivawealth.com. So without further ado, let me introduce our featured guest. Marilyn Smarin is a friend and a strategic partner with Spectrum Insurance Group. Our firms have been working together for about 15 years now, I think, Marilyn. And
yes, easily.
Yeah. And she's helped many of our clients by educating them and helping them acquire both individual health insurance as well as Medicare supplements. She's my go-to resource on everything Medicare and has been an invaluable partner to our clients and our firm. So good afternoon, Marilyn. Thanks for joining us.
Hi, Adam. Thanks for having me.
Well, we are excited to have you on, and let's jump right in. And let's just start with the basics. Would you mind giving us a breakdown of the basic components of Medicare?
Well, Medicare's primary focus, of course, is breaking down the coverage into pieces. So Medicare A is hospital, Medicare B is your doctors, your outpatient hospital, any kind of testing, that's all covered under B, along with a lot of diabetic supplies. Medicare C is your Medicare Advantage plans, and that gives you Medicare A, Medicare B, and Medicare D combined into one package, and D separately as a prescription drug plan. So you can buy A and B alone. You can buy A and B with a supplement and Part D, or you can buy a Medicare Advantage plan and get them all.
You would think they made it a little bit easier than having 9 different pieces of it, right?
But it's the government.
Yeah, they're never going to make it simple.
They're not going to make it easy.
Well, I appreciate that summary. And we're going to dive back into these components in a little bit, especially as we discuss cost. But one thing you didn't mention there is long-term care. Many of our clients that don't have firsthand experience are under the belief that Medicare is going to cover long-term care expenses. And specifically, we're talking nursing homes, assisted living facilities, in-home care, anything that we would define as custodial care. Can you discuss the relationship between Medicare and long-term care?
Well, Medicare is a medically necessary coverage. So it will cover nursing home care where you require skilled nursing in order to take care of you properly. When it gets to the point where it's custodial care, Medicare will not cover those services. You will be billed 100%.
Yeah, and I think we find that as a common misconception. And there are occasions by which, as you mentioned, that a nursing home stay will be covered. But generally, it's going to be limited in capacity. There are very specific rules that say how many nights do you have to be in a hospital? How long, does that have to be? You have to be discharged specifically to a nursing home. So there's a lot of parameters that are built around that. And I think the main thing we try to make sure our clients understand is that we need to have a plan outside of Medicare for long-term care expenses, because it is not designed to be a long-term care plan.
Absolutely.
And I think actually Social Security statements about 6 years ago started putting that on the back of their statement, saying you should not rely upon Social Security or Medicare and any government benefits for long-term care. You need to start figuring that out yourself. But a very important thing we want to make sure we remind our clients as they start planning for their retirement. And long-term care expenses are one of those things that can certainly have a significant impact on a retirement income plan. So now let's talk about timing. One of the most frequent questions that we get is around timing of Medicare. When am I eligible? When should I sign up? And I often joke with our clients that after you turn 21, there's not any really good birthdays or landmark birthdays until you get to 65. So why don't you kind of chime in and tell us, about Medicare eligibility as well as when people should sign up for it?
To me, startup for turning 65 is a 7-month parameter. You can enroll 3 months before your birthday, the month of your birthday, or 3 months after, with no penalties, no changes in provisions, and your coverage will always be effective the first of the month following your enrollment. So just like the screen that you have up that shows if you do it the month after you turn 65, then you're effective the first of the second month. So always the first of the month following your enrollment.
Understood. I think that 7-month rule is a significant, benchmark for people, because we often get that question is, when do I take a look at that? And obviously, depending on when you want that coverage to start, those sign-up dates are pretty important. And you want to talk a little bit more about general enrollment payments and kind of signing up for the premium-free Part A later?
Well, we can cover this part because otherwise I think I'll be confusing, but signing up for Part A is kind of somewhat contingent upon you deciding to elect you're taking Social Security. If you take your Social Security benefit at 65, which most people aren't doing now because it's not their full entitlement, but if you do take it at 65, you're automatically enrolled in Medicare, automatically. But if you don't do it, then you have to go to the general enrollment period, which is the first January 1 to March 31 of every year, and your coverage won't start till July 1. The other provision to this is that doesn't include if you're covered under a group.
Mm-hmm.
If you're currently on a group and you decided you're going to retire or drop the group, you have a special enrollment period, which would allow you to go in the first of the following month.
Yeah, they consider that like a qualifying event that would make you eligible to start.
Exactly.
Very good. Lots of rules on timing, a couple different enrollment periods. We'll talk about open enrollment here in a little bit as well. But let's talk about cost. When we develop plans with our clients, we spend a lot of time with our clients that are leading into retirement. And very often our planning software will build out what we call what if scenarios. That says, what if I retire at 62? What if I retire at 64? And I think it's eye-opening for a lot of folks to see what the actual cost of health insurance is out of pocket, especially if they say they want to retire at 62 and self-fund that until 65. So that's certainly a very important conversation to have. But for today, we're going to focus on what does the cost look like when you actually get into Medicare eligibility. So would you mind talking us through, we'll kind of break down each different part, but talk us through the cost of each one of the segments of Medicare?
Well, let's assume that you've been working, it's actually considered 40 quarters or the equivalent of 10 years, then Medicare A is going to be free to you. If you haven't worked and you're going to be asking for Medicare coverage, the premium per month could be anywhere from, I think it's $297 to $497 a month for Medicare A. Medicare B is currently $148.50 per month for the average person. if your income is in excess of, now I think it's 88.5 this year, there could be an additional fee, and that's assessed at the time of your application. The monthly premium of $148.50 today may be $158.50 next year.
Mhm.
They haven't published it, but that's what I'm hearing.
That's generally increasing each year.
It increases each year. Last year by $3. I mean, it depends on the number of people in the plan. So each year, as we're all enrolling, this is what's happening, is causing an increase in the premium.
Yeah.
There is a $203 deductible for Part B and a $1,484 deductible for Part A. Those are annual.
And can you speak a little bit more about, we have a lot of clients that kind of get caught off guard, that they believe the premium they read online that, it's going to be $148 a month. And then, the increase in income surprises them. Can you talk a little bit more about, how long that takes to kind of cycle off until they get back to the baseline premium?
Well, getting back or reducing the increased IRMA depends upon when their income goes down and is reported to Social Security. So every year, if you have an account on socialsecurity.gov, you can watch what's being reported, and you can see when you come underneath the threshold for an increased premium payment.
Mm-hmm.
But it could be years.
Yeah, depending on your work history and how long you're continuing to earn income.
Yes, yes.
All right, let's talk about Part D coverage.
Part D is the prescription drug plan, and there are probably roughly 40 now prescription drug plans on the market. It is best to pick your drug plan based on your current needs. Medicare.gov has a great facility for showing you what drug plans are available based on not only your prescription drug coverage currently, but also on the pharmacies that you use, which pharmacies will get a better benefit than others, which are preferred pharmacies versus standards. And we'll continue to update every year and give you a fresh look should you choose to build yourself a platform on Medicare.gov.
And can you talk a little bit about the Part D penalty, when that would apply and what that number would be?
When you end up with A and B, you need to select Part D at the same time. You should never have a gap 62 days. The minute you have a gap of more than 62 days uncovered, either by a group plan and a qualified prescription drug plan, they will assess a penalty, which is 1% of the national average, which is about $32. So 1% of $32 assessed every month forever. It never goes away. So it's not a huge penalty, but if you don't enroll for 2 years, it's that little penalty times 24 months added on every month. A prescription drug plan can be as inexpensive as $7 or as expensive as $180 a month, depending upon your individual prescription needs and the carrier.
Quite a wide range. And I want to step back to Part B very quickly on the Part B late enrollment penalties as well. Can you talk a little bit more about the timing and the penalties there?
Adam, in all the years I've been doing this, I have never had a person get a penalty for Part B. I don't know why anyone would get a Part B penalty. A lot of people who are on group plans elect Part A because the carrier tells them that they want them to take Part A to continue their coverage, but they don't take Part B because that's covered under the general plan and they have adequate coverage. So they don't enroll in B. But if you have a group plan that's credible, when you call Medicare and you say, okay, well, I'm going to leave my group plan, I want to enroll in Medicare Part B, they ask you to submit a form that says you've been on a plan and there is no penalty. So I don't know why anyone would ever have a Part B penalty.
Got it. So as long as you are filing appropriately at the appropriate times, and most people, I'm assuming, are jumping on during special enrollment periods, which also don't qualify for a penalty, correct?
Correct.
All
You
right.
got this down, Adam.
I'm getting there slowly but surely. Let's talk about Medicare Advantage plans and Part C. You mentioned that that's a combination of A, B, and D. Can you talk a little bit more about costs and I'm sorry, not D. We did D. I'm sorry, Medicare C, which is a combination of A, B, and D. Talk a little bit about premiums and deductibles there.
Medicare Advantage plans have come a long way in the past. I think the most changes have been in the last 5 years. You can get, as advertised on TV every 20 minutes, a Medicare Advantage plan that's 0 premium and has medical, dental, vision, over-the-counter allocations, a little bit of everything. And it might be 0 premium. It could be an HMO, it could be a PPO, it could be a very restrictive network. You won't know until you look at the ones that are available in your specific area. There are Advantage plans from Aetna, Humana, Blue Cross, United Healthcare through AARP. Just about everybody offers one now. It's what your specific needs are, but they can be a really good fit. There's a lot of people that have opted for them in the last year. Some of them that were DuPage Medical Center people, that what is now Dooley Health, took a sample of 35 of their physicians and switched them to only accept Medicare Advantage people. So a lot of those clients switched to a Medicare Advantage plan, and I have heard no complaints. Now they picked higher rated ones. They picked PPO plans with a premium of about $145 a month, but that includes medical, dental, their prescription drug plan, and some ancillary coverages as well.
So as people are making that decision between a Medicare Advantage plan as opposed to buying A, B, and D, what do you generally recommend as far as, how they should start narrowing that down and which path they should go down? I certainly imagine that which medications they're taking are important. The doctors in the network are important. But when one of our clients calls your office and says, I need to start, narrowing this down, how do you normally get them started, and what should they be thinking about first?
I like to do quotes for both, sending them both after they kind of give me a snapshot of where they're going. A lot of people who take Medicare Advantage plans don't want to pay that Medicare supplement increasing premium every year because those are age related. And so they shift to a Medicare Advantage plan that gives them more benefits with the same or lower premium. So I like to show them both and let them see how the benefits fit them.
Understood. All right, and then let's go into Medigap plans. So talk to us a little bit about Medigaps, what they cover, and their costs.
Medicare supplement policies are policies that cover now, since you can't buy Plan F anymore. So Plan G covers everything but your Part B deductible, which is $203. It pays the balance on all of your 20% balance fees from what Medicare pays. So you have no out of pocket. None.
Mhm.
But as an example, a person who has today, who's in their 70s and has the original Plan F, which covered everything, including the Part B deductible, would be paying somewhere in the $250 a month range. Okay. Plan G, person starting at 65 years old to 67, maybe, in the 145, 150 range, increasing every year in April. They almost all do April increases. They are not restricted by open enrollment. So you can kind of go in and out of them during the year, but you could be subject to underwriting.
And generally speaking, who would you say, if you said either a category of people, either based on age or good health, bad health, who would you say are the people that you're most inclined to say should be looking at Medicare supplements?
I don't do good health, bad health, because what you have as good health today could be bad health tomorrow.
Sure.
I choose to look at it as, where do you wish to put your money? You can buy a Medicare Advantage plan, a really great one, $150 a month. You could save the difference, $150 to $250. You could save that $100, bank it for the copays that you might have or out-of-pocket expenses you might have on a Medicare Advantage plan. But if you're unsure about that and you're comfortable paying that $250 a month and knowing that you have 100% coverage, then that's the best plan for you.
Yeah, sounds like simplicity is key there. That just says the cost ahead of time. You one-stop shop. You pay it, you're done, and you don't have to worry about everything else.
Yeah, yeah. So, but again, some people are more comfortable with the Medicare Advantage. Either plan gives you great coverage. Just one has copays and lower premium, and one does not have copays and higher premium. Where do you want to put your money?
Understood. Well, we always like putting our money to work, so that's our preference. But like you said, that's an individual planning discussion for each one of our clients.
Exactly.
All right, so thank you for that very thorough breakdown of the different pieces and their costs. Let's talk about something that we're seeing happening more and more is clients deciding to work beyond 65. So you mentioned a little bit of this already, but can you talk about what our clients who are working past 65, what are the things they should be doing at their 65th birthday and beyond?
I don't think there's anything that's changed. As I mentioned earlier, most carriers are going to want you to be enrolled in Medicare when you turn 65, even if you're still on the job. The difference between big companies and little companies is who gets to pay first. If you're in a small base company, Medicare is going to start. If you're in a big company, the company's going to stay primary carrier and Medicare is going to be secondary. So it all kind of depends upon what size the business is for who pays first. Mm-hmm. And COBRA fits in. You can drop COBRA to pick up Medicare. You can stay on COBRA till you're done and enroll in Medicare. You'd have a special enrollment. COBRA is usually higher than switching to Medicare. So it's just, maybe you're in the middle of a procedure. Maybe you want to finish some kind of care before you transfer coverages. It all gets very personal. It's hard to be generic.
Yeah, that's a line I often use is when it comes to advice like that, it can be generally right, but individually wrong. So, but that does make a lot of sense to say it's certainly you want to focus on cost and efficiency, but there may be times when seeing a medical procedure through is the best medicine. And let's talk about those folks that again are still working. How do they sign up for Medicare?
I recommend, well, there are two options. You can go to Medicare, directly to Medicare.gov, you can enroll through socialsecurity.gov. You can enroll through Social Security and not get Social Security, just get Medicare.
Mhm.
And because it is a government agency, you tell them what date you want, but sometimes they don't make it. So the earlier you can do that 3 months before your birthday is a really good indicator, especially for Medicare or Social Security. Getting there as quick as you can and getting that coverage started on your effective date, the first of the month of your birth date. So even if your birthday is the 29th of the month, your coverage is going to be effective the first of that month.
Understood. And you talked a little bit about the integration of Medicare with your insurance, as far as, if you're still working, how do you apply? But I'm going to put this graphic up. Can you talk a little bit more about, this, if you're a small company versus larger companies, and when Medicare tends to interact versus, what's primary and what's secondary?
Well, that's what I was saying. That's based on the size of the firm.
Mhm.
If your job has less than 20 people, small business like our agency, Medicare pays first, and any job-based coverage comes in second to cover anything not covered by Medicare.
Mhm.
If you're at a large firm, the large firm pays first. Medicare comes in as secondary carrier. They pay balances. It's not like a true COB, but they transfer from one to the other to try to give you as much coverage as is possible.
Understood. And then I think the important point you laid out here, the third one, is that if we have people that are either don't have health insurance through a job, if they're contractors or they're doing part-time work, obviously if they don't have that coverage, that's not going to integrate well. And if they're getting stipends, right, which is becoming increasingly popular, if employers say, well, we won't pay for the insurance, but we'll give you money to pay for it. Generally,
Yeah,
Medicare
they'll just have Medicare.
You're going straight to
Yeah, they would just have Medicare.
Understood. All right, let's talk about Part D. Let's go back to Medicare. One of our clients asks us, we get this often, is do we really need this prescription drug coverage? Can you give us your insights as to, for Part D, who's suited for it, especially when you're not going with one of the Medicare Advantage plans? Who should be looking at Part D?
Everybody needs Part D. If you're on Medicare, then you should have Part D. Even if you don't take any prescription drugs currently. And I know that's irritating, because why would I pay for a plan if I don't need it? But it's kind of the same concept as all insurance. You're paying for it for if you need it. And as we talked about, that 1% of the national average for the rest of your life, that penalty is applied if you don't apply for Part D coverage when you're first eligible. So we want to enroll in D either through a standalone plan with a supplement or Medigap policy, or through a Medicare Advantage plan that includes Part D.
Understood. And can you talk a little bit about the term creditable drug coverage? I'm sure that most people are not quite familiar with that.
Medicare determined that language when they started the drug program. And what it basically comes down to is that the drug program that you currently have under your existing group policy has at least the lowest benefit of the Part D plan. So you could have one that pays 90% of all your drugs and you'd be way above the Part D plan, but it has to be at least as good as the base Part D plan as established by the government.
Understood. And so when they're calling in, they're just making sure they have that information available to share that and share that with the Medicare office, correct?
Yeah, they should be getting something from their carriers that tells them that their drug coverage is credible. or if they change their plans to decrease benefits, then the carrier will send out a notice telling them that their drug coverage is no longer credible. And then they need to know then that they have to go get a Medicare drug plan.
Understood. All right. Well, we've got a couple questions here that I'd like to get to, if that's all right with you. We're going to go off script, but I know that doesn't bother you at all, Marilyn. I'm going to read this. One of our clients said that a husband and wife each have income from investments. They are retired, not earning earned income, but have investment income. And they're deducting from both of their Medicare the maximum amount, which they believe is $580. And the question is, why would they be deducting from each of them individually when they joint file? Shouldn't it be half from each spouse? So the difference of 290 each as opposed to 580 each.
Well, if I could do it, I would make it that way, but that's not what they do. They ding both members. They hit the husband and the wife unless they were filing separately. As long as they're filing jointly, then they assess them both.
And can you speak to that if they were filing separately? Not that we recommend people file separately just because of Medicare, but can you stipulate what's the difference there?
Well, then I would guess that on the Social Security earned income reports, that one spouse would show a much lower income than the other one. So one might get assessed higher, but the other one might not. But they could close that loophole tomorrow. So I don't know if that's the answer either. I only have a couple clients currently that I know of that are max rated, but it was husband and wife.
And they're both getting it together.
Yes.
Well, there's very many ways that our government finds a way to tax those who have money and make money. And now we're learning of just another one of those. The other question that we have here is somebody asked, who do you work for? So I mentioned earlier in the presentation that Marilyn works for Spectrum. Marilyn, do you want to just speak a little bit to your role at Spectrum and very specifically the role you play with clients when clients of ours chat with you?
Well, first of all, we could probably go back to the beginning. Spectrum bought Regit Incorporated, and some of the people might know Regit for a lot longer than Spectrum. Spectrum's been on its own about 4.5 or 5 years now, as a result of an agent working with Regit, who then bought the business from them as the owners of Regit decided to retire. So I've been, as a total, with Regit and Spectrum 22 years. I handle the individual book of business under and over 65.
Yeah. And just for those who are not familiar with either one of those firms, both Spectrum and Regit are health insurance brokers. So you guys are brokers, meaning you work with all the different insurance companies out there. You guys will shop those plans out. And it's not only limited to individuals and Medicare. A lot of our business clients, you guys are working with them in securing group coverage as well. And I think you guys, we've had a few of our clients that have been really intrigued in working with you, especially small business owners who are approaching 65 and say, I not only want help on my actual group plan, but I want to have a firm that has understanding and integration of Medicare supplements with a group plan, versus having to work with two different resources for that. And one thing I'll say is that Marilyn, again, has been great, has worked with a lot of our clients in getting quotes for individual health insurance, for the Medicare supplements, as well as just reviewing benefits to say, well, if you're not quite there yet, but you're trying to get an idea of cost, Marilyn is a tremendous resource. And if anybody is looking to connect with Marilyn to learn more about their supplements and have these conversations, feel free to either message me or email me directly, and we'll make sure that we connect those dots. So as we close, I wanted to go through a couple quick takeaways. So part of the timing, or the reason why we did this webinar the way we did, is because open enrollment is coming between October 15th and December 7th. That's the time where you can switch drug plans, enroll in or disenroll in Medicare Advantage plans. Marilyn, do you want to speak a little bit to anything with respect to open enrollment that our clients need to know?
Well, this is the time every year when the carriers let you know what their new plans are for the upcoming year. Medicare Advantage and prescription drug plans can change benefits the first of every calendar year. So there could be an increased benefit, could be decreased premium, could be increased premium. All of that is available to you starting October 15th, and you can select any of those plans up until December 7th. And they would be effective for the first of the following year.
And then you mentioned that even though you have this window, there is the ability to potentially change the supplements during the year, but you could potentially face underwriting to do so. Can you speak to just generally what that type of underwriting is and what they may face?
Well, there can be, there's a base rate structure for all Medicare supplement plans, as I mentioned, and they're age rated. But let's say you're with Blue Cross today and you decide that your friend said she's got United Healthcare's with AARP and you want to go over there. So we can do the application, but it's going to ask, do you have any severe health conditions? Have you been in the hospital in the last 6 months? And it could mean a rate up. It could mean they're not interested. So don't cancel the one plan until you know the other one's going to be in effect.
That is a great rule for really any insurance transitions. You certainly don't, you don't change boats before you're securely into the next one.
Right.
And then one other piece here, we talked about reviewing benefits. This is something that I find that most people set up their plans, get in the plans. They're glad to be done with planning all this and dealing with Medicare. But how often do you recommend people review their benefits and all the Medicare supplements? And specifically, what should they be looking for? You mentioned there's been a lot of change, especially in some of the Advantage plans over the last 5 years. So for somebody who maybe has a plan, hasn't looked at it in 2 to 5 years, what would you recommend they do and what steps to take to review that?
Well, I think that everybody should look every year at what they have. I mentioned a little bit earlier about that program on Medicare.gov.
Mm-hmm.
It is one of the only programs that I'll use in looking for prescription drug plans or Medicare Advantage plans for my potential clients. And I do that because it doesn't know who you are. I shouldn't say it doesn't know who you are. It doesn't have any predetermined ideas of what carrier is better. It just tells you what's out there and what would work based on your prescription drugs or based on the pharmacy you want to use. And if you create your own database on there, it will transfer from year to year. It will update as you fill a prescription. It will change your prescription history. And the next year it'll say, wait, there's another carrier that's got much better prescription drug benefits. Why don't you look at it? It doesn't say go change it. It says look at it.
Mm-hmm.
And every year, a person who has a Medicare Advantage plan or a prescription drug plan gets the annual notice of change that comes out by the 1st of October. And it'll tell you what your current plan has, what your current plan is changing, if there's a premium difference, and you can use that to decide if what you have is still your best bet.
Mm-hmm. And can you, again, that online resource, and where can our clients go to find that?
Medicare.gov.
Medicare.gov, and then is it what would they be looking for specifically? Is it like a coverage?
It says find plans.
Uh-huh. Very good. All right, and then the one last question that came in is from one of our clients who I know likes to have the best of the best and expects the best of the best. If you had a plan that says this is the Cadillac of Medicare supplements, Medicare Advantages, top of the table, what company is that? What coverage plan is that? What would that be?
That would be, I have no answer for you. Part of the program for selling Medicare Advantage and prescription drug plans is to never, ever, ever say one plan is better than another. It's part of the ethics. You have to swear to it. I could never make that statement and say, I don't want to sell anything else. It's only this. I can give you an example and tell you that if you picked an Aetna Medicare Advantage plan, they have in network all 5 teaching hospitals. They are the only carrier that has all 5 teaching hospitals. Is that important to you? Then maybe that's your Cadillac. Illinois is a Blue Cross state. People love Blue Cross Medicare Advantage plans. Is that your Cadillac? I can't tell you that. You have to decide what is a Cadillac and what's a Ford.
No, that's a great point. That it's your beauty is in the eye of the beholder, right? And for me, anything that has Northwestern in it, of course, I'm going to gravitate towards that, but that's not necessarily the case for everybody. And I think to that point, it's a good observation to close on that. That this information can be generally right, but individually wrong for every one of our clients based on their health history, based on their age, based on their current medications, based on their risk tolerance. All this planning should be customized, personalized, based on their individual needs, as opposed to just blanket advice and blanket information.
Absolutely.
Well, Marilyn, I can't thank you enough for joining us and lending us your time and your expertise. You're clearly head and shoulders above all of us on knowledge above this. And 15 years, I've learned a good amount. I still got a lot more that I could learn from you, but we generally appreciate your time and your insights. And we're going to continue our clients to encourage them to come contact you, to talk to you about their individual situation, reviewing their existing coverages, and filling in the holes of what can be a pretty complex planning topic. So thank you again.
Thank you, Adam.
And everybody, ladies and gentlemen, thank you for joining us today and taking your time to be with us. We hope you found this useful. And our goal continues to be to do whatever is necessary to help you look at the future with anticipation and not with anxiety. We've helped hundreds of families retire successfully and deal with all these topics that surround retirement income, and we can help you get it right. So please remember that the team here at Cultiva Wealth is glad to be a sounding board to you and your family and those you care about. If these people are important to you, they're important to us. So please don't hesitate to use us as a resource. Hope you all stay well, make healthy decisions, and we look forward to seeing you soon. Thanks so much. Have a good evening, Marilyn.
Bye-bye.